Akshay Deshpande, consultant gastroenterology. Welcome, doctor. To discuss your queries on irritable bowel syndrome. Doctor, can you just brief us on what is irritable bowel syndrome?
Thank you, Jitendra. Irritable bowel syndrome is a chronic disease of intestine, and it affects many people in our society. And going by the statistical data, nearly about 5 to 20% of people in our population can have this disease. I mean, imagine the magnitude of this disease. And the main problem with this disease is that it affects the day-to-day activity of the deceased person, and thereby interfering in his day-to-day life. So the common symptoms of irritable bowel syndrome is the first one is the pain, and pain associated with change in pattern of stool. That maybe it might be a increased stool frequency or decreased stool frequency, and it can also be associated with form of stool, that is constipation or a loose stool. And the fourth one is that most of these patients do have any to show improvement after passing symptomatic improvement after passing stool. So this was in brief about how IBS or irritable bowel syndrome symptoms present. So I think we can go ahead with the question and answer session.
Okay, doctor. Yeah, okay, doctor. Doctor, what are the triggers in IBS?
So IBS is mainly triggered by most commonly three things. One is it can be an infection, it can be an emotional stress, or it could be a physical stress as well, and as well as change in food. In food, the most common ones which we see is that it can be a lactose which can trigger it, or any fructose. People tend to have fructose intolerance. That is, whenever they consume fruit rich in these things, the symptoms get exaggerated. And infection also trigger any intestinal infection, also, or systemic infection can worsen the IBS symptoms.
Okay, doctor. Doctor, can you explain us the role of stress in exacerbating the IBS symptoms?
Yes. See, the IBS is a multi-dimensional or multifactorial disease. It does not start with just one single factor. There are two or three things associated here. One, when we consider intestine, there is infection in the intestine, or there is a disbalance or imbalance between good and bad bacteria. Whenever the bad bacteria in our intestine increase, then there is a local inflammation in the intestinal wall, which kind of exposes our intestine to too many newer proteins or allergens, thereby triggering an immune response in the intestine. So, because of this local inflammation, there is pain, which is the first symptom of IBS. But this pain kind of blows out of proportion or gets prolonged. That is another characteristic of IBS. The reason for these exaggerated pain is that because there is a constant inflammation which is going on, the nerve endings which are present in the intestine, they get triggered very often. And there is also exaggerated level of chemical mediators at the nerve endings, which get triggered with just tiny or a very simple stimuli of infection. So every time a new problem happens in intestine, either it can be a bloating or infection or stress, these pain pathways get activated, and these pain stimulus reach our brain, and which interprets these signals in a very exaggerated way than a normal individual experiences. So there are multiple levels these things work at multiple levels. So stress is definitely an important thing, and this pathway just which I explained just now is something called as a gut-brain axis. That is, there is a definite link between an intestinal problem and as well as our brain. So we'll have to if we have to control this disease, we'll have to control it at multiple levels. One is at intestine, as well as the pain pathways, as well as also the brain response to this pathways. So stress, either it could be an emotional or a physical, can aggregate our brain response to these pathways. So even if there is a lighter pain perception because of stress, there can be an exaggerated response. That's how this disease work.
Okay.
So
Doctor, what causes IBS?
yeah, that's what, as I explained in the last slide, no, it's a multifactorial disease. There are multiple levels of involvement, that is at intestine, pain pathways, and brain. All these together cause IBS, and it's a complex pathology altogether. So we'll have to control it at all these levels, just like the one I explained in the last question.
Okay. Doctor, how do you diagnose this IBS?
So, diagnosing in IBS is based on the symptoms I explained, like pain, which is associated with abnormal stool form or consistency, and improvement after passing stool. Whether these symptoms are present, and if there are no other red flags, by red flags I mean there should not be any weight loss, there should not be any blood in stool, there should not be any low hemoglobin, significantly level of low hemoglobin, or there's significant reduction in appetite along with these symptoms. So if these symptoms are red flags are not there, then most likely it's an IBS. We do some common blood test and stool test before we come to a conclusion of IBS. And very rarely we might ask for a colonoscopy if we feel that this patient needs to be diagnosed better, or if there is a differential of or something called as an inflammatory bowel disease, we can ask for a colonoscopy to differentiate these two things.
Okay. Doctor, are there any specific dietary recommendations or restrictions that can help?
So when we diagnose irritable bowel syndrome, so treatment starts with diet, lifestyle modification, and plus medications. And it also depends on how severe the disease, how severe disease patient has. There are various courses available online by which we can assess whether the patient has mild disease, moderate disease, or a severe form of disease. So if we start with dietary modifications, patient has to observe what triggers when it comes to diet, because each patient differs in his own way. So, but the most common ones are like the one I explained. One is milk, or it can be fructose. Some people have wheat intolerance. Some people tend to have intolerance to bread or the other dairy products. So all these are common things, and some specific fruits as well. Some things like mango, apple, cranberries. All these can are the things which can trigger an irritable bowel syndrome. So such things patient can notice, and during an acute phase, these things need to be reduced. And once the disease is under control, they can be reintroduced.
Okay, doctor. Doctor, what role does exercise play in managing IBS?
Yeah. So as we discussed earlier, so stress is one of the major factor, and this happens at the central nervous system area. So exercise helps in two or three ways. One is it will help in the intestinal motility part, and the other if the patient is having constipation. The second is that it will help us release natural endorphins, which kind of suppress the pain pathways and also suppress pain perception by our brain. So there are many studies wherein exercise has caused significant reduction in IBS symptoms, and this statistically, this is somewhere around 20 to 30% of patients showed symptomatic improvement. So exercise plus diet are two main non-medical lifestyle changes which patients should do.
Doctor, is there any relation between IBS and other health diseases?
Yeah, the IBS can be associated with various diseases. One is that it can be associated with gastroesophageal reflux disease. It can be associated with some psychiatric disease like anxiety or depression, Some people tend to have something called as a chronic fatigue syndrome or fibromyalgia. So these are the things which are commonly associated, and all these things are interlinked because they are associated with gut-brain axis, as in case of irritable bowel syndrome.
Okay. Thank you so much, doctor, for your insights on IBS. And thank you for joining us. And to book your in-person appointment with Dr. Akshay Deshpande, you can log into our website and book your appointment, or you can download our app from Play Store and book an in-person appointment with the doctor. Thank you, doctor.
Thank you.
Thank you so much.